If you spent the last few weeks researching your vasectomy and you're more afraid now than when you started, that's a sign. And we're going to talk about it because it tells us something specific about where you've been getting your information from. We've done over 30,000 vasectomies at our practice. We've been doing this for more than 20 years. And the men who walk in most anxious are almost never the ones with complicated anatomy or unusual medical histories. They're the ones who've been deep in online forums. The information they found is real. The information environment they found it in, however, is broken. And that's what makes normal procedures look rare and complications look like the rule. There are 5 signs that the advice you're getting is painting a distorted picture. If you recognize yourself in any of them, it doesn't mean something is wrong with your situation. It means you need better sources. We're going to walk you through all 5 signs, and at the end, we'll tell you exactly what to do instead. The internet has no mechanism for the quiet majority. When thousands of men have a vasectomy on a Friday and return to work on Monday, none of those men post about it because it was uneventful. There's really nothing to say. However, when one man has a difficult recovery, he has something to process, vent, and complain about, and forums give him the perfect place to do it. So the forum fills with stories of difficult recoveries and stays silent about the easy one. Easy recoveries are common. People who feel fine simply don't go looking for somewhere to talk about it. The same gap exists on the provider side. Practices across the country perform vasectomies with very different levels of experience, and the information men receive before their procedures reflects that variation. Some of it is thorough, and some of it is not. Knowing what to look for is the only way to tell the difference. If your research has taken you to Reddit threads, Facebook groups, or vasectomy forums, you've been reading a sample that was broken before you ever found it. Here's the mechanism. People post on forums when they're in pain, when they're scared or angry, because they need somewhere to discuss what they're going through. That's a legitimate use of those spaces. But the men who had their vasectomy on a Thursday and were back at their desks the following week don't post. There's no story to tell. They had their vasectomy and they've moved on. So the forum ends up looking like a place where complications are constant and painful recoveries are normal. However, complicated recoveries are not the norm, but they are the recoveries that typically get shared online. The research you've done is real, and the time you've put in is real. However, the sample you read from is not representative. If your picture of vasectomy outcomes is primarily based on forums, your picture is representative of the forums, but is not representative of the actual population of the men who had this procedure. The specific check here is simple. Ask yourself where the information came from. Patient education materials from a medical practice, published guidelines from a urologic association, a physician walking you through your own anatomy during a consultation. These are designed for the full population. A forum, however, is designed for the subset of people who have something to vent about, because that makes it post-worthy. Those are 2 completely different animals. If a provider gave you a specific recovery estimate before examining your anatomy, that number came from a general playbook, not from you. Recovery from a vasectomy depends on a few things. It depends on the technique used. It depends on how carefully the provider handles the tissue during the vasectomy, because tissue trauma is the primary driver on how long your recovery will take. And it depends on your individual anatomy, because no 2 men are exactly alike. A quote of 2 to 4 weeks off work with no examination is a number pulled from the average of a general practice, not from an assessment of your specific situation. At our practice, which is dedicated exclusively to vasectomies, our surgical technique has been refined over tens of thousands of procedures. Our experience has taught us a lot. Tissue handling improves with meticulous training, repetition, and experience, which comes after performing 30,000 vasectomies. Our team has seen virtually every anatomical variation there is. That translates directly to recovery time, because less tissue trauma means less to recover from. Let's be honest. It's rare to find a practice that only does vasectomies. Most practices that offer vasectomy offer it as one of many urologic procedures that they do. The volume of our vasectomy-specific experience is simply unique, and that volume and expertise is what drives our technique and your recovery. Here's your check. If your provider gave you a recovery estimate before physically examining you, ask them to walk you through what that estimate is based on. A thorough answer considers surgical technique and your anatomy. A generic answer doesn't. If you're finding this useful, drop a comment below and tell us, how many weeks of forum research did you do before you found this video? And did it make you feel more confident or less? We're genuinely curious, because the answer tells us a lot about where men are getting their information right now. The semen analysis is the only test that confirms a vasectomy worked. If your provider hasn't brought it up yet, that's a gap in your preparation. Here's what it is. After vasectomy, the vas deferens, which is the tube that carries sperm from the testicles, gets cut and sealed. But the sperm that were already in the reproductive tract before the procedure are still there. Your body clears them over the next several months following the vasectomy. The semen analysis is a lab test where the sample is collected at home and submitted to a lab. These tests will confirm your sperm count has reached 0, and that confirmation means sterility. Without confirmation, a man can still get a woman pregnant. Men who skip the semen analysis are the primary reason vasectomy-related pregnancies happen. They think they're in the clear as soon as the procedure is done and they're off the table. Now, a lab result is the only thing that truly confirms the absence of sperm, meaning you're no longer able to get a woman pregnant, and that result comes months after the procedure. These are two separate events, and they both matter. If your provider hasn't mentioned that semen analysis before your procedure, ask about it directly. A practice that takes the finish line seriously will have a clear protocol: when to submit the samples, what the lab is looking for, and what the results will mean to you. If the practice performing your vasectomy also treats kidney stones, prostate disease, bladder conditions, and urinary issues as its primary work, your vasectomy is one procedure on a long list. This is a volume question, and the volume belongs to the practice, not the individual doctor. A doctor who performs vasectomy as one part of a broad urologic practice does it less frequently than a practice dedicated exclusively to vasectomies. Volume drives precision. The technique, the tissue handling, the experience with unusual anatomy, the efficiency in the procedure room, all of it improves with repetition. And over the past 20 years, our practice has performed over 30,000 vasectomies, and we've seen a full range of anatomic variation. Our learning and experience has compounded. We've refined our vasectomy technique and protocols over the years, and our patients are the ones who benefit from it. That's what exclusively performing vasectomies produces, and it's what other places lack. Here's your check. Ask the practice how many vasectomies they perform per month, and whether vasectomy is their primary or their sole focus. The number matters, the focus matters. Both of them together tell you something a website bio won't. If you feel more afraid about your vasectomy now than you did when you first started looking into it, the information environment is broken. That's a sign in and of itself. Here's what should happen when research is working. You start with questions, you find answers, and you feel more informed and less afraid over time. The unknowns shrink. By the time you show up for consultation, you have specific questions to ask, not a growing list of things to worry about. If the opposite has happened, the information you've been reading is creating more questions than it's answering. Good information closes the loop. A broken information environment creates new loops faster than it closes old ones because it's calibrated to the most alarming outcomes, not the most common ones. Fear itself is data. It's telling you something about the source, not about the procedure. A man who has spent 3 weeks reading forum posts about pain, failed procedures, and complications isn't better informed than he was before he started reading. He's just more frightened. And the fear is a signal worth paying attention to because accurate information about a routine procedure with a high success rate should make you feel calmer, not more anxious. The most useful thing you can do right now is bring your questions directly to the practice you're considering. A real consultation with a physical examination of your anatomy is the only place you'll get information personalized to your body and your specific situation. Not information about an average man from a general paper, and not information from those worst case posts on a forum. Ask the provider how many vasectomies the practice performs per month. Ask what the semen analysis protocol looks like and when you're supposed to do it. Ask what their tissue handling technique is and how it affects recovery. A practice that takes these questions seriously and answers them specifically is giving you the kind of information no forum can. If the answers are vague, or if the consultation is just you watching the video and signing a form instead of an actual examination, that's just another one of those signs we talked about. Fear that builds during vasectomy research is almost always a sign of where the research was done, not a sign of what the vasectomy is actually like. Now you know what to look for. If you want to understand the real reason men get vasectomies, the one that has nothing to do with fear and everything to do with what they're protecting, watch this next. It's called The Real Reason Men Get Vasectomies, Not What You Think.